Good evening, my name is Sarah Harden. Today is November 8th, 2024. I'm in SPEC680 and my professor's name is Bryce Taylor. I'm going to go ahead and get my timer set for 1 minute. I have my deck of cards. I'm going to shuffle 3 times. 1, 2, 3. I'm going to cut my deck in half. And I'm going to hit my timer and begin. Behavior that is selected, maintained, and brought under stimulus control as a function of its consequences would be operant behavior. Correct. Behavior that is maintained by consequences would be operational behavior. Operant behavior. Wrong. Behavior shaped without directly collecting or contracting contingencies using rules. Pass. Communication system based on applied behavior analysis, ABA, that uses pictures would be PECS. Correct. Represent a description of the literature by a professional qualified to examine the research base. Pass. A way of describing behavior by the topography of what it looks like, its function, its consequence, operational definition. Correct. A range of strategies used to process and determine motivation of an individual engaging in significant behavioral disruption, how the behavior relates to the environment would be the function of the behavior. Functional behavior assessment. Wrong. So I got 3 right and 3 wrong at 1 minute. I'm going to stop and I'm going to continue with my cards. Typically includes analysis of the quality, quantity, and consistency of the literature related to either, I'm going to say pass, systematic review. Comprised of the following: identifying best source of scientific evidence, review relevant. Pass. The number of responses per unit of time or frequency divided by the unit of time would be rate. Correct. This property represents the elapsed time of a response, or how long. This would be the temporal effect. Correct. Stands for say it all, fast, minute, every day. That would be safmeds. Correct. A person's condition with regard to their psychological and emotional well-being should inform behavioral analytic treatment to other providers would be mental health. Correct. Behavior analysts refer and document referral for their clients if they suspect that medical or biological variables impact the client's behavior, considering medical needs. Correct. Conditions that are often likely to co-occur, for example, ADHD and learning disabilities, would be comorbid diagnosis or conditions. Correct. The process of differentiating between 2 or more conditions which share similar signs of symptoms. Differential diagnosis. Correct. Everything a person is capable of is repertoire. Correct. The involuntary repetition of words or phrases that someone else says is echolalia. Correct. ABC, use to study and understand everything that a person is capable of, is the 3 something target. I don't know. 3-term target. Solicit support from others and create a natural context for the behavior would be social support. Correct. The proportion of a population found to have a particular condition at a certain time would be prevalence. Correct. The range of differences in individual brain functions, behavioral traits, I'm going to say pass. Neurodiversity, I knew that. A set of observable characteristics of an individual resulting from interactions and its genotype with the environment would be phenotype. Correct. Short prescriptive description of a particular situation, event, or activity, which include information about what to expect in a situation and why. These descriptions also include visual images corresponding to the description would be social stories. Correct? This property represents when the behavior occurs with latency as measure. That would be temporal locus. Correct? The ingestion of inedible objects would be pica. Correct? Determining the cause of the behavior actually is would be testable behavior. I don't know. Testable behavior. An observable and measurable action of behavior. Response? Yes, correct. Occurs when a model evokes a physical response which is topographically identical. I'm going to say pass. Motor imitation. I did know that. Subjective attitudes, feelings, and other constructs that attempt to internal factor to explain the behavior. Mentalism? Yes, correct. A mental health condition when a person is unable to speak in certain social situations, often attributed to fear or anxiety. Selective mutism? Correct. Includes all forms of communication other than speech that are used to express thoughts, needs, wants, and ideas. AAC? Correct. Behaviors that inflict harm or person emitting the behavior is SIBs. Correct. Behavior analysts infuse diversity-related training in their supervision. I'm going to say pass. Incorporating and addressing diversity. I did know that. Represents the accuracy of which an intervention or independent variable is implemented. Pass. Treatment integrity. Structured method utilized to identify highly preferred items, actions that can be used as reinforcers to keep motivations levels high when teaching. Preference assessment? Yes. Inability to perform purposeful actions such as simple movements or speech. Apraxia? Correct. Includes determination of whether resources such as sufficient staff ratio and supports proficient supervisors who are able to provide training to supervisees that are required for the intervention to be implemented and present in the situation. Feasibility, correct. A brain disease where nerve cells often don't signal properly, which cause seizures, is epilepsy, correct. A chemical compound used to treat or cure illness, medication, correct. Behavior analysts collaborate with others to improve services of their clients and compromise when faced with conflict, collaborating with your colleagues, correct. A neurological and developmental order characterized by social communication skill deficits in the presence of restricted, repetitive patterns of behavior. Autism spectrum disorder. Correct. Individual who receives the treatment would be the target client. Correct. Overall count on a certain bit of behavior, the number of times the behavior occurs would be frequency. Correct. How long the behavior occurs is duration. Correct. The time between the onset of some environmental event, for example, discriminative stimulus, and the target response would be latency. Correct. A standard observational assessment tool that helps diagnose autism spectrum, ASD, in children. I'm going to say something autism scale. Pass. Autism diagnosis observation scale. Close. A means of assessing the validity of the theory regarding the causes of disorder or facet of a disorder based on the fact that the cause always precedes the effect. I'm going to say pass. Primary criterion. Behavior in which an individual free time in a conversation is dominated by their special interest. Restrictive behavior. Ritualistic. I knew that. The number of new cases per person year would be incidence. A disability that affects the acquisition of knowledge and skills characterized by sub-average IQ deficits and adaptive skill functioning would be intellectual disability. Correct? Pretend play, often called imaginative play, imaginary play. Yep. Behavior analysts collect I can't even read my own handwriting. Represent and analyze the data accurately to make decisions about the clients. I'm going to say pass. Collecting and using data. A research method where a small number of participants are evaluated under carefully controlled conditions to monitor the behavior over time. Single case design. Yes. Extent to which treatment is fair, reasonable, appropriate, unintrusive, and likely to be recommended to others. You say pass. Treatment acceptability. A standard interview that helps diagnose autism spectrum disorder in children and adults. Autism diagnostic something. I can't remember. Interview. The American Psychiatric Association Professional, DSM-5. Correct? A change in behavior is learning. Correct? A standard system used to code diseases and medical conditions, comorbidity data, ICD. Correct? When one person purposely coordinates his or her focused attention with that of another would be joint attention. Correct? Thank you so much.